Get ready for Benjamin Knight Fuchs live. Coming to you live on YouTube, Facebook, LinkedIn, all over the internet. Ben, how are you?
Well, good to see you. I'm all bunched up here today. I don't know why. I don't look as handsome as you.
Oh,
you know how to dress. I don't know how to dress right.
Nice thing for you to say.
Anyway, well, good to see you, my friend Liam.
Good to see you, Benjamin.
We're going to talk about something really interesting today. I find it very interesting. If you suffer from this condition, you may not find it interesting. You might find it a drag because it's a really miserable health challenge that affects women. Put the first slide up there if you don't mind.
Certainly.
Liam. We're going to talk about endometriosis. And endometriosis is a condition that affects the endometrial lining, obviously. Endometrial tissue, which is the lining of the endometrium that women lose every month when they have their menstrual cycle. Unfortunately, in 10% or so of women of reproductive age anyway, can show up in different parts of the body. This can be a very, very troubling and painful health challenge because endometrial tissue, number one, is glandular tissue, so it makes hormones, and now you've got hormones in different parts of the body, particularly in the abdomen and the pelvis, various parts of the reproductive system. So you get a surge in these various hormones. It's also vascular. This vascular tissue can show up in different parts of the body, which is bloody. And then probably most problematic of all is the connective tissue relationship. The endometrial tissue that shows up in the abdomen, in the intestine, the ovaries, various tissues, is also connective in nature, so it can cause adhesions and fibroids. And this is partially the cause of tremendous pain that endometriosis patients suffer from. So you've got a hormonal dysfunction, you've got a vascular dysfunction, you've got a connective tissue dysfunction, all of which can account for tremendous misery, particularly during the menstrual cycle. It affects, as I say, 10 to 15% of women between the ages of 15 and 44, mostly women between the ages of 30 and 40. That's about 10 million Americans, 190 million women around the world. And it is really, really ridiculously miserable and painful. It's also associated with a lot of comorbidities. Patients who have PCOS, patients who have cysts, fibroids, reproductive cancers, appendicitis, irritable bowel syndrome, chronic kidney disease. All of these are comorbidities that can occur with endometriosis, which tells you that if you're dealing with endometriosis, this is a serious metabolic dysfunction. If you're dealing with endometriosis, the chances are pretty good that you have lots of things going wrong in your body. Nobody just has endometriosis. There is some thinking nowadays that endometriosis may be an autoimmune disease. And that's because there are autoimmune antibodies to the endometrial lining, that is, antibodies that attack the endometrium in the case of in the blood of patients who have endometriosis. And recently, I find this incredibly fascinating, Liam. Recently, there has been something that came out called the bacterial contamination theory of endometriosis, because it turns out that toxins from the intestine show up in the blood of endometriosis patients. Now, where have we talked about this before?
Triangle of disease.
Right? This is the triangle of disease. And now naturopaths and functional medicine folks they think that they've got this revolutionary theory they just discovered. Oh, there are bacterial particles like on lipopolysaccharides in the blood of endometriosis patients, which are particles from bacteria in the microbiome in the intestine that show up in the blood through a leaky gut. Hello. We've been talking about this forever. Don't wait for, people the scientific folks to validate our theories here. Just go to the triangle. So anyway, I found that really interesting that you've got this bacterial contamination theory, and they believe now that it rather than being an estrogen issue, which is the current and conventional wisdom, it's really an immune condition. Now, whether it's immune or whether it's estrogen, certainly estrogen is involved, but you always just want to go back to the triangle. We'll show a couple of slides here in a moment. People who have endometriosis do tend to be estrogen dominant. That is, they have high levels of estrogen or estrogen signs of excess estrogen, including breast fibroids or fibroids throughout the body. Obesity is often involved, excess body mass. there are high levels of metabolites of estrogen. We've talked about these before, so-called catechoestrogens in the blood of endometriosis patients. These catechoestrogens are technically called hydroxyestrones. You may have heard that term, 2-hydroxyestrone or 4-hydroxyestrone or 16-hydroxyestrone. It's this 16-hydroxyestrone metabolite of estrogen. These are catechoestrogens that rev things up. Estrogen already is a rev you up hormone, but these catechoestrogens, I'll tell you how these accumulate here in a minute, those are super amping or revving up hormones, and they're associated with really pretty much all of the problems that get blamed on estrogen are really linked to these hydroxyestrogens or catechoestrogens like the hydroxyestrones. So how do these hydroxyestrones accumulate? Well, there's 3 ways. Number one, it can be excessive exposure to estrogens through xenoestrogens, foreign estrogens in cosmetics, and plastics, and medications, and hormone replacement therapy or birth control pill. You can also have a buildup of these hydroxyestrogens if you're not metabolizing the hydroxyestrogens appropriately, particularly if you have deficiencies in magnesium. Also deficiencies in methylating agents, because eliminating these hydroxyestrones involves methylation. So if you're deficient in methylating agents like choline, for example, or SAMe or the B vitamins, you may also have a buildup in these hydroxyestrogens. I'll tell you some strategies that you can use to improve the elimination of hydroxyestrogens. And then there's a third element, they call a phase 3 detoxification of estrogen, which is elimination through the bile. And so if you're missing a gallbladder or you have sluggish bile or sticky bile, you may also be accumulating these toxic metabolites of estrogen. There's a test that they'll give you called the Dutch test, which stands for dried urine test for comprehensive hormones. They call it the Dutch test, and they can assess you for how well you're eliminating these hydroxyestrogens or these catechoestrogens. But you can just assume that you have high levels of them if you're dealing with any estrogenic issues, and that includes autoimmunity, reproductive issues like infertility, dysmenorrhea problems with your menstrual cycle, fibromyalgia, and of course, what we're talking about here, endometriosis. So go to the next slide, if you would, Mr. Liam. This is the new theory that I was telling you about, bacterial contamination hypothesis, a new concept. It's not new. It's a triangle of disease, people. And I'm telling you, Liam, and everybody listening, you're going to see more and more about this, how the diseases that we consider to be either hormonal diseases or autoimmune diseases or genetic diseases, there's always going to be a link, if it's a chronic condition, to this bacterial contamination or endotoxins or LPSs or leaky gut or histamine. So what does that tell you? Go back to digestive health. Always go back to digestive health, and I'll give you some strategies here in a minute. Next slide. This is from Frontiers in Cellular and Infectious Microbiology, November 2022. The gut microbiota in endometriosis, from pathogenesis to diagnosis and treatment. Once again, we learn that the gut microbiome plays a role in the etiology or the development of pathogenesis, the pathology of endometriosis. That's the first point on the triangle of disease. Next slide. Second point on the triangle of disease. And again, just like there's always going to be intestinal issues, leaky gut, dysbiosis, secretion of histamine or LPSs, lipopolysaccharides, so-called endotoxemia, you're also going to find disruptions in glucose metabolism, dysregulations in glucose metabolism in all chronic diseases, including endometriosis. From the European Journal of Medical Research, endometriosis is associated with systemic metabolic indicators, that is metabolic syndrome, including body mass index and glucose metabolism and lipid metabolism. Next slide. Resolving endometriosis-induced pain utilizing a low glycemic index diet. Low glycemic diet. The glycemic index is a measurement of how fast a food turns into sugar or how fast a food raises blood sugar. Low glycemic foods, a low glycemic diet, or foods that are part of the low glycemic diet, are slower in terms of their release of sugar and their ability to raise blood sugar. Proteins are going to be low glycemic index. Foods with fiber are going to be low glycemic index. The worst glycemic index foods are juices, fruit juices, especially certainly soda pop. Liquid sugars are going to be very high glycemic index, and refined carbohydrates. And it's always a good idea to restrict or lower or completely eliminate your intake of refined carbohydrates, cereals, breads, pastas, these kinds of foods, but particularly if you're dealing with endometriosis or really any chronic degenerative disease. Next slide. Our third point on the triangle of disease is, of course, cortisol, stress hormone. Here, cortisol levels are higher in women suffering from endometriosis. Next slide. Of course, we know that elevated cortisol will lead to hypothyroidism, endometriosis, and thyroid dysfunction, the connection you need to know. Next slide. Role of thyroid disimmunity and thyroid hormones. That's from the University of Paris. Again, we find that thyroid hormones are hypothyroidism and thyroid dysfunction is associated with endometriosis. No surprise. There's lots you can do for endometriosis that involve nutrition. If you go to the doctor, you go to the medical route, an endocrinologist or an OBGYN, they're going to do surgery. They're going to try to give you hormone replacement therapy. They might do an ablation, but you don't need these strategies. And they really, while they may work for the endometriosis, they're not going to make a difference in the metabolic or the biochemical pathologies, breakdowns that are the cause of the endometriosis. So you're still going to run higher risks for diseases, even if at best you don't have your endometriosis symptoms, which is why you always want to use dietary, nutritional, and strategies that affect the causes of the endometriosis, which of course is the triangle of disease. Next slide. This is from Acta Biomedicine, 2021, dietary supplements for treatment of endometriosis. And they have also some real juicy ones. Vitamin D. Women with endometriosis had lower vitamin D levels compared to controls. And there was a negative relationship between vitamin D levels and severity of endometriosis, meaning the lower your vitamin D levels, the higher the severity index. And the higher the vitamin D, the lower the severity index. Zinc can also be beneficial for folks who are dealing with women who are dealing with endometriosis. Intake of zinc in women without endometriosis was higher compared to women with endometriosis. That is, women who had endometriosis had lower intake of zinc than women who didn't. Magnesium may be the most important of all the nutritional supplements for endometriosis for a couple of reasons. It's very anti-inflammatory. But magnesium is also important for detoxification of those catechol estrogens that we talked about. Plus, according to this article anyway, VEGF, vascular endothelial growth factor, which is a growth factor that stimulates the production of vascular tissue, which is, of course, one of the kinds of tissue that moves from the endometrium to the various parts of the body when you have endometriosis. Turns out VEGF decreases after magnesium, and therefore, quote, it might be useful in gynecological diseases that have angiogenesis, that is blood vessel growth, in their pathological process like endometriosis. Omega-3 fatty acids, fish oil supplemented adolescents with endometriosis were reported to have a 50% drop in inflammatory scores. Women with higher circulating EPA, which is a derivative of omega-3 fatty acids, are less likely to have endometriosis. Propolis, which comes from bees and is high in a very interesting flavonoid called chrysin, can also improve prognosis of endometriosis. Likewise, quercetin, and one of my favorite supplements, N-acetylcysteine. Animal studies have shown that N-acetylcysteine shows significant decreases in main lesion areas in folks who have endometriosis. And then combined NAC and alpha lipoic acid and bromelain. Very interesting. Bromelain is a digestive enzyme which has some interesting anti-inflammatory properties. NAC, alpha lipoic acid, and bromelain significantly decrease the pain in endometriosis in endometriotic women. Probiotic use is beneficial in patients with endometriosis. This, of course, tells us about the microbiome and dysbiosis and intestinal bacteria when you have, or problems with intestinal bacteria when you have endometriosis. And then lastly, alpha lipoic acid. Use of alpha lipoic acid may be a suitable option to decrease symptoms and improve the quality of life, especially in patients predominantly presenting with endometriosis pain. A couple more, actually. Vitamin C was shown to significantly reduce the volume and weight of endometrial cysts. And vitamin E, patients who supplemented with vitamin E showed a significant reduction in chronic pelvic pain, dysmenorrhea, that is problems with the menstrual cycle, and inflammatory markers associated with endometriosis. Selenium, which is always good when you have an estrogen problem. Selenium helps balance out estrogen. And something called EGCG, or epigallocin-3 gallate, which is found in green tea, significantly reduced the growth of endometrial implants. Green tea is amazing stuff, folks. You know, green tea is the number one used beverage around the world. And green tea is wonderfully anti-inflammatory, anti-aging. And now we find that ECGC, epigallocin catechate, you should look that up. ECGC is also anti-inflammatory. That's the main antioxidant that's found in green tea. Next slide. Prospective cohort study on vitamins B, C, E, and multivitamin intake in endometriosis. Thiamine, love that stuff, vitamin B1, folic acid, vitamin C, and vitamin E from food sources are inversely related to endometriosis risk. That is, the more thiamine, folate, vitamin C, and vitamin E you're getting, the lower your risk for endometriosis. And then finally, last, this is really cool. One of my favorite topical nutrients is progesterone, as you know. I talk about that all the time. Next slide, Liam. Progesterone alleviates endometriosis via inhibition of uterine cell proliferation. Two things about this. Number one, if you are deficient in progesterone and you're making a lot of estrogen, you can have some of these imbalances that will that may cause endometriosis as well as other inflammatory issues. And this is why using progesterone, particularly progesterone topically, can be beneficial. Also, as we age, our progesterone drops much more dramatically than our estrogen levels. And you're always making a little estrogen as long as you have body fat. So using progesterone either supplementally, and you can take it not supplementally, but medically, I should say, on a prescription, and they dispense it orally as a prescription, or using it topically over the counter can have wonderful estrogen balancing benefits for all estrogen health challenges. Plus, progesterone has a calming effect. We talked about progesterone on our last video. And I want everybody to know I have a progesterone available through my pharmacy called ProHarmony Serum, which is a progesterone topical serum that you can use if you're dealing with endometriosis, or you're dealing with problems with your menstrual cycle, or fibroids, or cysts, or infertility, or you're just revved up on estrogen. Estrogen is an amp you up hormone, and you're dealing with night sweats or hot flashes or the signs of menopause, which can involve estrogen, either elevated estrogen compared to progesterone, or problems eliminating estrogen, or problems getting estrogen out of, or problems detoxifying estrogen. That's phase 2. We talked about methylation and also using magnesium for phase 2, or phase 3 detoxification. If you have your gallbladder taken out, or if you have a bile issue, or if you have a liver issue, use progesterone. It's non-toxic. As I said, I make a great one. You can get it pretty much anywhere, but I like mine because mine is just a serum with vitamins and no preservatives. It's great on the skin. It's anti-aging for the skin. Plus, it will help balance out your estrogen levels. It'll help restore the progesterone to estrogen balance. So you can always reach out to me at my pharmacy. You can send me an email, ben@ksco.com, if you're interested in that. And then last but not least, we have one more here. The ketogenic diet is a calming diet as well, and it's been used to treat a lot of female health issues, including endometriosis. This is an article that talks about the ketogenic diet improving fertility outcomes, low-grade inflammation, body weight issues, visceral adipose issues, that is fat in the viscera, in the belly, and around the organs, and its potential use in certain types of cancer. And then it's also been used to treat obesity, type 2 diabetes, and pretty much all inflammatory conditions. It says here, quote, the ketogenic diet is successful in ameliorating the inflammatory state and oxidative stress through several mechanisms. The ketogenic diet, if you don't know, is a low-calorie, high-fat diet. This is very important. Most people, when they hear the ketogenic diet, think of the fat part, and it's true. With the ketogenic diet, you want most of your calories coming in from fat. That is about 80% or so. That's a lot, right? 80% of your calories from fat, maybe 70 to 80%, we'll say, and then another 10 to 20% from protein, and then another 10% from carbohydrates. So the conventional thinking is that the ketogenic diet is a high-fat, low-carb diet, which is sort of true. But really, it's not a high-fat, low-carb diet as much as it's a high percentage of your calories coming from fat and a low percentage of your calories coming from carbs. When we say percentage, this is important because the ketogenic diet is a low-calorie diet. It doesn't mean you're eating a lot of fat. It means you're eating a high percentage of your fat, of your calories are coming from fat. So you don't want to be eating bacon and cheeseburgers and potato chips and pizza. You want to be getting a high percentage of your 1,200 or 1,000 to 1,200 calories coming from fat. In other words, your ketogenic diet is a 1,000 to 1,200 calorie a day diet, which is pretty darn low calorie considering most people are getting 2,000 to 3,000 or even more calories a day, sometimes up to 4,000 calories a day. So 1,000 calories, for argument's sake, we'll say 1,000 calories, about 800 calories or 700 to 800 calories come from fat. That's not the same as eating a bunch of bacon or donuts. 700 to 800 calories coming from fat, which is 70 to 80% of your 1,000 calories, means maybe some avocados and some eggs and some fish. And that'll get you your calories from your 700 calories. You may have to eat 2 or 3 avocados and then maybe a couple eggs and then maybe a nice piece of fatty fish. And that'll get you your calories, your 70 to 80% of that 1,000 calories a day. If you're eating donuts and potato chips, you're going to get way more than 1,000 calories a day. So the real key to the ketogenic diet, in addition to the high percentage of your calories coming from fat, is the low calories. That's really, really important. So there's lots of things you can do if you're dealing with endometriosis that don't involve the doctor, that don't involve surgeries. I told you I'd tell you about some nutritional supplements you could use in addition to the ones we just talked about for detoxification of estrogen. So real quickly, estrogen is broken down in 3 steps. And where it gets really problematic is the first step actually makes estrogen more toxic, more powerful. And it's already a powerful hormone. In fact, estrogen is the most powerful of all the steroid hormones, more powerful than testosterone, than progesterone, than DHEA. It's at the bottom of the hormone flow chart where hormones are synthesized from cholesterol. So it is the most powerful and the most potent, and the body has to eliminate it very quickly. So it eliminates it through what's called phase 1 detoxification. And we can talk about these on another video, by the way, because they're very important. Phase 1 detoxification creates those catechol-estrogens, those super powerful estrogens. Estrogen already revs things up, but the catechol-estrogens, which are produced in phase 1 detoxification, are super estrogen. Those are what we talked about earlier, the hydroxyestrogens, or the catechol-estrogens, hydroxyestrone. There's 2-hydroxyestrone, 4-hydroxyestrone, and 16-hydroxyestrone. 4 and 16 are especially problematic. If you're wondering if you're producing high levels of these, or you have high levels of these in your body, get the Dutch test. What's supposed to happen when you're healthy is that phase 1 step where the catechol estrogens are produced is supposed to go to phase 2, where these estrogens are actually made more easier. They're easier for the body to eliminate. They're actually reconstructed, so the body has an easier time to eliminate them. The catechol estrogens are then methylated via methylating agents. Also, magnesium is involved in the process. If you're deficient in magnesium, and many people are, you're going to have a buildup of your hydroxy or catechol estrogens. And if you're not methylating, same thing. That's where you want to use your methylating agents. And that's also where you want to be supplementing with magnesium. And then there are a couple really interesting foods that you can use. Cruciferous vegetables, broccoli, Brussels sprouts, cabbage, and cauliflower. These are all great foods that you can use to support the elimination of these catechol estrogens or support phase 2 detoxification. And then also selenium-containing foods, for example, Brazil nuts or seafood, which are high in selenium. Those can also improve phase 2 detoxification. Sulfur can improve phase 2 detoxification. You can use MSM sulfur, or you can use sulfur-containing foods, which are high-protein foods like beef, eggs also. And then quercetin, which is a flavonoid, that can also help with phase 2 detoxification. And then there's a couple supplements that you can use. One's called DIM, and another's called I3C. These are actually found in cruciferous vegetables, but they've been extracted by nutrition companies, and you could use them supplementally. Of course, fiber will also help with the elimination of estrogen through the bowels. That's your phase 3 detoxification. You can use bile salts to improve phase 3 detoxification, particularly if you have a bile problem or a gallbladder problem. Ox bile is another supplement you could use. The amino acids taurine and glycine and lecithin or lecithin granules or lecithin oil can help you eliminate estrogen through the bowels via bile, first through bile and then through the bowels through phase 3 detoxification. And then it's always a great idea to work on body fat. Remember, estrogen is made in body fat, so losing body fat by getting to the gym, working out, not eating as much sugar or as much fatty foods, much processed foods. All those are great strategies. And of course, using strategies for approaching the first point on the triangle of disease: probiotics, fiber, I-26 hyperimmune egg, which I keep here on my desk, on my messy desk somewhere. Hyperimmune egg can kill those excess bacteria. You can use vitamin A to strengthen the intestinal lining if you're dealing with leaky gut. Collagen peptides might help. Fucoidan can help with leaky gut. Of course, staying away from problem foods is going to be important. Lectins from various vegetables and vegetables and grains. Lectins are problematic compounds that induce inflammation at the level of the intestine. We know that gluten is an example of a lectin, so going gluten-free, but really avoiding any foods that cause digestive distress is important, and then lowering blood sugar through staying away from foods that spike your blood sugar, but also using chromium, vanadium, niacin, the B vitamins, and other nutrients that help with blood sugar. This is all for endometriosis, folks, but you're going to get anti-aging benefits. You're going to get weight loss benefits, anti-cancer benefits, anti-heart disease benefits as well when you approach the triangle of disease. Plus, you'll reduce or completely eliminate your endometriosis symptoms. All right. That's our chat on endometriosis. There's so much stuff. I know I go through this stuff really fast, but what I want everybody to understand is we have medicalized health challenges that are really based in lifestyle. We have medicalized health challenges that we can take care of ourselves by making lifestyle changes, particularly changes in how we eat, how we supplement, how we exercise. Not to mention psychological issues which will affect your health. I'm not going to go there. Think intestine, think blood sugar, think digestive support, food support, as well as nutritional supplementation.
And you said 90 million women suffer from
around the world. Yes, ma'am. Yeah, yes, sir. And one of the worst things about endometriosis is a lot of times when people complain about endometriosis or just pelvic pain or pain throughout the body, the doctors will give them Prozac. They'll say, "Oh, there doesn't seem to be anything wrong with you. You're just depressed. So here's an antidepressant." And so a lot of women who are dealing with chronic pain, that includes fibromyalgia, by the way, or endometriosis, and it's not happening as much, but it used to happen a lot where women would go in and complain of these kind of pelvic pain issues or chronic pain issues, and they'd leave with an antidepressant because the doc thought they were crazy.
Unbelievable. And ProHarmony.
ProHarmony. Yes, that's my progesterone serum. You can write me at ben@ksco.com. It's $97 for about a 6 to 8 week supply, depending on how much you use. It's super effective for balancing out estrogen, for problems with menopausal problems with menstrual cycles if you're younger. And then also it's great for your skin too. And it feels great. It feels great topically, but it's also great for just treating your skin from an anti-aging fashion. All it is progesterone, an ester from argan oil that helps drive the progesterone through the skin, and a few vitamins A, D, and E.
So for women suffering from difficult periods and problems of that nature, there is hope.
Yes, menstrual issues, endometriosis, infertility, or also menopausal symptoms or perimenopausal symptoms as well.
All right, fantastic info.
Good to see you, Liam. Thank you.
Good to see you, Ben. And
thank you, everybody who's listening now and in the future.
Here's the I will have to put your other email up there, Ben. But you can reach Ben at
you can reach me over here. That's my personal email. That's fine.
Gmail or me at info@liamgaligas.com. It was a pleasure, Ben. Thanks everybody so much for watching.
See you next Sunday.
And we'll see you next Sunday.